Hi, I'm Vanessa Lee, registered nurse, top aesthetic injector, and a trusted authority in the world of beauty and skincare.
I'm Nurse Janet, aesthetic nursing director at The Things We Do, and trainer and mentor to new and future injectors. Welcome to the podcast. Join us as we cover all the things we do for beauty, weird shit included.
This episode is sponsored by The Things We Do. Come visit our locations in downtown LA, Venice, Chino Hills, Beverly Hills, and coming soon in Oahu. You can also inquire about our appointments and get a feel of what we do through our IG and TikTok at thethingswedo.co, or simply stroll on into the beauty bar and pick up all of your skincare essentials. We want to hear from you. Please send us a DM on our IG at thethingswedo.co with your questions and comments, and we will be choosing a listener to shout out and have their questions answered on upcoming episodes. Okay, this is my favorite subject. We're talking about consultation. So today we're going to talk about we're going to go through a mock consultation with Nurse Janet here and show you guys what the first 10-15 minutes is with us at The Things We Do if you're a first-time patient with us. We do the same consultation for every single patient that comes in, whether you're seeing me, Janet, Jetsy, Steph, B. We do the same thing every single time, and it helps us as providers really streamline and prioritize what to do for you as the patient, and it also helps the patient focus on what they could possibly have done, because a lot of times providers will let the patients lead and we'll have very open-ended questions. And a lot of times patients, you guys feel like there's so much to be done and are harder on yourselves and will jump around to, lips and then under eye and then, this weird thing that happens around your eye when it smiles only on the right side. Oh, and then the double chin area and like all of that stuff. So it's a great way for us to just kind of prioritize, organize the plan, and really be able to figure out what your best features are and how can we enhance those more, how can we balance the face so it brings attention more to your favorite features, and what are the things that we can do to rejuvenate the features that you don't feel like are your favorite or are changing over time. And so I guess we can go ahead and get to it.
Let's do it.
Is there anything before we get started that you feel like really stands apart with our consultations from how you previously used to do consultations?
I mean, I've said it once, I'll say it again. I never did consultations. Definitely not how we do it. How I used to do it is I was never taught, first of all. No one in my practice did consultations. I wouldn't ask such in-depth questions, and I had like this pre-printed sheet that was like more product recommendations versus like treatment recommendations, like how much of a certain product you're going to use and for which area, and then like the price point underneath. So it was nothing like how we do now, where it's more like what treatments and like the effect that they're going to get. Definitely no The Things We Do beauty plan. Nothing like that.
So before I developed this script specifically for consultations for myself and The Things We Do, it's so interesting that you say that, because I don't think I was ever really taught by any place that I worked at how to properly do consultations. Yeah. I was always trained on techniques. Yeah. But never the opening conversation of how do I get the patient who's sitting in this chair to become open to me using these techniques on them according to their concerns.
I always felt like it was an area I fell short on, because one time I had a patient, I think I mentioned this in one of the other episodes, but I never did a consultation. So she came in for Botox. So I did Botox on her and lip filler. And then when she came back to see me in 4 months, she's like, oh, I went with my friend somewhere and she was getting a treatment done and she did a consultation. And they did a consultation on me and, oh my gosh, they pointed out my temples and I didn't realize I needed my temples. And once they pointed it out, I was like, oh my gosh, you're right. I looked back at a picture. I definitely had a little bit more volume there. So I got my temples treated. Janet, it was the best thing I've ever done. And my heart sank.
Why?
Because I remember I noticed the temples. I didn't know how to present it, and I didn't feel comfortable presenting it to a patient. So 2 things right there. I wasn't taught proper consultation skills, and then I held back because I didn't want to hurt someone's feelings. But professionally, patients are there because they want your professional opinion when it comes to these things. So someone else benefited off treating this beautiful patient because they weren't afraid to have a thorough consultation. They were trained on it and they weren't afraid to hurt her feelings, hurt her feelings. No feelings were hurt. It was just all in my head. So
yeah, I think a lot of it goes into like, if someone comes in for a specific concern, why would I bring up anything else? Like, I don't want to make them feel bad if they're happy with that. I think that's a really interesting standpoint and perspective to have, because everywhere else in medicine, there's no place for us to say, I'm going to withhold these medical suggestions because it might hurt someone. I get a full blood panel as a nurse, as a doctor, as whoever your provider is, a PA or NP. I would never say, I'm going to tell them about these results, but I'm not going to talk about their cholesterol being high, because what if she feels like I'm calling her heavy? Like, there's no way. You're going to give the full picture, right? So same thing with aesthetic medicine. Even though we are talking about the face, it makes sense for a provider and also for a patient to get a full baseline assessment of where they are. Yeah. And there's very gentle ways to deliver that information. It really comes from, how you're delivering it and where it's coming from in your heart as a provider. That really projects onto the patient. So make sure that your intentions are good when you're delivering these things. What I don't want you to do is keep in mind, I have this quota. The business that I work for has this quota. Is this patient going to be my $6,000 patient? Is this going to be... Throw the money out the door, okay? The money is going to come to you because you're doing the right things for your patients. And for the person who needs that procedure, talk about it with them. But for everybody else, you are to not talk about things that they absolutely don't need, okay? So providers, please really hear us out on that. Okay, I think we can go ahead and get to it.
Let's do a consultation.
I was going to do the consult on you, but I think you should do it on me.
No, I want you to do it on me, because now I have a whole script in my head now. Okay. You asked me to.
Okay. Let's do it. Okay. So first, I like to come in and meet the patient and really make sure that the initial contact I have with them is as meaningful as possible. So I like to take their hand in my two hands and I say, hi, so let's do it.
Yes,
we're role playing. Hi, I'm Vanessa. I'm going to be taking care of you today.
I'm
it's
Janet.
So nice to meet you.
Nice to meet you.
Where did you come in from today?
Santa Clarita.
Okay, great. Oh, so you took the 661 to the whatever. You see, that's not a real freeway. I don't even know where Santa Clarita is. That's fine.
No, it doesn't.
But in Southern California, we immediately start talking about traffic. That's like a very easy thing for us to like bond over, right? Oh, so what
Thanks
freeway
for
is that?
In. The
Thank
14
you for coming
to the 5.
all the way out here. The 14 to the 5.
Yes.
Oh, shoot. Did you hear about what happened on the 5 this morning? Did you get around it okay?
Yes, but I'm so happy to be here.
I'm so happy you're here. Thank you. How did you find out about us?
My friend Rachel told me about you.
Okay.
So I've been waiting 2 months for this appointment.
Okay, fantastic. So what I'd like to do at this point, it's my first time meeting you as your provider. And so I want to walk through a proper full consultation for you. I do this for all of my patients. So what's going to happen is I'm going to give you a mirror and I'm going to ask you a few questions. And depending on your answers, I'll give you your best and safest options. And what you feel good about moving forward with today, we'll do that. Does that sound good?
Yeah, perfect.
Okay, great. Pause. So what I did right here was I told her what we're about to do. I find that for most patients, they like to be able to know what to expect. So I tell them what we're going to do, and then I'm going to do it. Then at the end, I'm going to review it. So by the time we actually do something, there is 0 questions about what is being done. You know exactly what we're doing because we've discussed it multiple times, and you were a part of that process, okay? Then we go ahead and get the mirror. So I'm going to go ahead and give you this mirror, and look into the mirror and tell me what your favorite feature is.
Oh gosh, that's so hard.
I could tell you 3 things right now that I love so much about your face, but tell me your favorite feature.
Maybe my eyebrows.
Okay, what do you like about your eyebrows?
They used to be really thin, and now they're a little thicker, and I like it. Ooh. I like it a lot more.
Oh, I love that. Yes. What was the secret?
I'm Armenian, so...
Wait, why were they thin before? Oh, because you were over-plucking before?
I was over-plucking.
And now they're in their full glory.
Yes, perfect.
Beautiful. Yeah. I love your eyebrows.
Thank
I really
you.
love how they frame your eye frame. You have gorgeous eyes.
Thank you.
And tell me if you feel like you have 1 or 2 things that you want to discuss with me today. What do you feel like is your first priority that you want to make sure we discuss?
So I feel like after I've had kids, I have 2 kids, I feel like everything is falling this way.
Stop. So let's talk about favorite feature first, okay? So I want you to start off with, what is your favorite feature with the patient? Instead of having them sit down and say, what brings you in today? What would you like to change? What's bothering you? What's your favorite feature, girl? What do you love about yourself, okay?
They're going to be so confused, but they actually
They are
smile.
always so confused. Like, okay, so I know that you gave your answer just now, but can we do what most patients do?
Oh my gosh,
okay, so what's your favorite feature?
I don't know. Like they say, I don't know. And then typically patients will get really emotional, right? Because they don't have a favorite feature about themselves. So they'll look and they'll be like,
I don't know. I don't have one.
I don't have one. And I just noticed this eyebrow is a lot lower. And then they'll start going into the negative.
They'll go into what they don't like.
Yes. Yeah. So patients get really uncomfortable.
And then we bring them back and we say very gently, if you guys are just listening and you're not watching us on YouTube, very gently, I place my hand downwards. I don't touch them. I'm touching you because you're right next to me.
Yeah.
But I place my hand downwards as to say, stop it, very gently. I go like this and I say, let's bring it back to what my question was. What's your favorite feature? And then patients really, they start to realize, oh my God, I actually have to answer this question. This is ridiculous. And the reason why we ask that is because it's not just a nice way to open the dialogue, okay? Even though it's a nice way to talk about, what we could possibly do for you. It's usually an indicator that's directly tied to what they want to discuss with you as far as their first priority of what you might need to be working on. So Janet said it was her eyebrows. A lot of times patients will say, well, my favorite feature used to be my eyes, but, since the past couple of years have been really hard. My husband was sick and I was taking care of him, and unfortunately he passed away. And there's a lot that's happening here around the eyes, and there's that deeper emotional connection that now you have to be so much more respectful of and really approach the entire situation in a very sensitive way, right? Mm-hmm. So sometimes it's not that serious. My lips are my favorite thing, but they've gotten thinner over time, and that's something that I want to work on for today. So usually the favorite feature is also the first concern or the first priority that a patient wants to discuss with you, and sometimes it's not, but most of the time it is. So it's a positive way to start the conversation, and 2, it's a good indicator of what you're probably going to be talking about next. Okay, so you talked about, as far as your first priority of what you want to discuss, you just said that there was a shifting, there was something changing, and then you touched your mid-face. Mm-hmm. When a patient says that, pause. So when a patient says that, I want to go directly into finding out every single clue of what she's seeing, okay? So I want to know all the things that I'm about to ask now that we're role-playing again.
Unpause.
And action. So tell me about that shifting that you're seeing. How long ago do you feel like you've seen that change? Was it in the past 3 to 5 years? Is it something that you just noticed in the past couple of months?
I feel like it's in the past year or so. I feel like I don't like how I look with makeup anymore. Everything just seems to be shadowing a little bit around here. It just looks like everything is falling.
Have you stayed a pretty consistent weight throughout the past couple of years, or have you had a pretty dramatic weight loss or weight shift in the past couple of years? And anything 10 pounds or more is dramatic.
Yeah, I lost about 25 pounds.
Oh, wow. Okay, great. Did you notice that after that weight loss, it was great for the body, but there were certain shadows in the face that were maybe amplified afterwards?
Yeah, and I noticed my under eyes as well. They started looking like I had bags or I had deepness in my under eye area.
Okay, that's good to know. Can you point out to me exactly where you started seeing those shifts? So in the mirror, I'm going to go ahead, look into the mirror. I'm going to give you a little pointer and go ahead and point to me
where I saw the shifts.
The shadows kind of,
So I started seeing shadows right over here in my smile area, and then definitely around my mouth.
Okay.
Definitely around my mouth, and then a little bit more in my under eye area here. And now that I'm looking at it, I feel like everything just looks a little hollow back here as well.
Okay. I'd like to get my hands on you and just assess through feeling the face, where there's possible need for some support and maybe shifting of the tissues. Before I do that, is there anything else that you wanted to discuss? I wouldn't imagine, but I just want to make sure I hear you out.
I feel like my skin has been very dry. It's very dull.
Okay.
Lately.
Okay, we'll talk about that too. Okay, so I'm going to get some gloves on, and then I put some gloves on. Pause. So behind the scenes, this is what I want you guys to understand. If you realize what I was doing, I had her repeat to me multiple times what her concerns were. 1, by asking clues, yes. But 2, the other thing that's doing is she's driving home her own point that yes, I saw some shifting, but what's happening is I'm realizing the shadows around my mouth, the fullness around my jowl area, the under eye area is starting to pop up more. And also I want to talk about my skin. So what has happened is I have gently allowed her to bring up all the things that I also want to bring up, but now it's a collaborative plan instead of me saying, here are all the things that are wrong with you. Okay, so my gloves are on now, and I'm going to go ahead and touch the face if that's okay with you.
Of course.
We've never had a patient say, don't touch my face. I don't want a full consultation. That's crazy. Every single patient is always like, yes, thank you so much. Please assess me. Okay, and so what I like to do is always start with the mid face. Okay, so I start moving the mid face area. Look into the camera for me. So this is all in silence, by the way, and what's happening here takes probably no more than 1 minute, okay? Maybe 30 seconds to a minute. So I'm shifting the tissues, lateral cheek, I'm working on, I'm going to the lateral gonial angle in the jawline, I'm moving the chin forward, I'm doing these things bilaterally, all in the same, all in opposing directions to see where I can get some lift and some light around the area. I'm working around the eye frame, I'm holding the brows. And then I say, okay, with excitement, okay, I have a plan for you, okay? And then patients are always like, what? What is it? Because that whole thing was in silence, so there's all this anticipation. When I'm touching the patient's face, Janet, will you tell everyone what the purpose of that is, the gentle part of that?
So let's say I was a patient who came in and I said, oh, my smile lines and my cheek area. That was it. And then once Vanessa touched my face and she touched areas like my temples or right back here by my gonial angle, that signals to me that she's paying attention to other areas that I've overlooked. And it kind of sets up the introduction for talking about other areas, like if I didn't mention the temples, like the temples or my lateral jawline back here.
What my interactions with patients have taught me over the past decade and a half is that they may come in for one thing, and then what ends up happening is once we start talking about that one thing, all of these other things that they have forgotten about come to the forefront of the conversation.
Yes.
Oh, yeah. And then my cheeks. Oh, and then there's some changing in my jawline. Oh, and then there's this. When really all of that is connected, right? It's gravity pulling downwards. It's fat pockets shrinking and shifting downwards. It's a change in the elasticity of the skin. So all of those things, it makes sense, are going to pop up. But usually patients see it manifest usually in one area, and that's usually like the mid face, and there's some kind of shifting going on there. So it's a very gentle way for us to give a nonverbal cue of we're probably going to talk about these areas. And a lot of times before I'm done touching a patient's face, they'll tell me like, oh yeah, I wanted to talk about this too.
Yeah.
It's a reminder that comes up for them. And again, it's a collaborative effort. It's not something where I'm like, I know that you wanted to talk about lips, but guess what? I'm touching all these areas of the face because we're going to do this specifically. It's a way for us to come up with this together, okay? And so now I'm done touching the face and I say, okay, I have a plan for you. And then I talk about the things that the patient has brought up. I like to reflect on those adjectives. So what I heard from you is that you're noticing the shifting of tissues in the mid-face, like something is kind of moving forward and downwards, and you're seeing more shadows, and around the eyes, things might feel like they look a little bit more shadowy to you or deeper, that they might need a little bit of support. When I'm feeling and touching the face, there is areas where I feel like you could use some hyaluronic acid support. So we can bring your features to the light, we can take away some shadows, we can minimize some shifting and sagging of tissues and give you a little bit more definition, have you look a little bit more refreshed around the eyes, around the mouth, around the jawline. And how I would do that is using hyaluronic acid support in these areas that I touched, because those are the areas that are actually contributing to directly what you were seeing. And so if you notice, I'm not telling the patient, we're using 5 cc's of this specific filler in these areas. I'm trying to deliver this information in a way that is not daunting. And it's the truth. We're using hyaluronic acid, gel filler for support in these different areas to bring her to light, to brighten these features, to minimize shadows, to redefine the jawline, and to essentially have your patient looking happier, healthier, and more rested. That's always the goal for our patients. That the things we do is to have you look just like yourself, but happier, healthier, and more rested. And I really lean on using adjectives that the patient has described to me, and also what I feel like would be reflected after the treatment. And so I will tell the patient, in order to get to this, I'm going to go ahead and write a plan for you on our
menu.
Oh my God. I'm going to write a plan for you on our menu. And on our menu, it has further details of the treatments that I'm going to list on there. It has our pricing as well. I'll leave that with you for about a minute, and then I'm going to come back in and you tell me what you want to move forward with. Okay? Do you have any other questions about anything?
No, that's it. Thank you.
Okay, great. I'll be right back. So then I shuffle to the back and I write down on our beauty plan portion, which is the back portion of our menu, and I'll write essentially what we're doing. So I'll write facial balancing and then the price for that. I'll write mid-face rejuvenation and then the price for that. If somebody is, really focusing around the eyes, or if I have to do that for a patient, I'll say, eye frame rejuvenation, and then I'll put the price for that, whether it's 3 syringes or if it's 2 syringes and a PRFM or whatever, I put the price for that. I find that if you put 1 cc of this, 2 cc's of this, 1 cc of this in these different areas, and then price out every syringe, patients get really overwhelmed and it looks like a lot for them. And they're like, I think I only need 2. And they don't really know that in the under eye area, we have to correct the medial cheek, the lateral cheek, the temple zone, and we're going to correct the tear trough. That's actually a significant amount of support. If you say things in understandable terms and everyday terms, like we're going to use maybe about a half a teaspoon to a teaspoon of hyaluronic acid to help support these areas, a patient's like, oh, that's not that much. That's great. But if you say we're going to use about 2.5 to maybe 5 cc's, 5 syringes of this stuff in your face.
Sounds like a lot, yeah.
It does.
Yeah, even to anyone.
Sounds like a bazooka.
Sounds like, you remember
That's
that?
an inside joke that we have.
Sounds like a lot, yeah.
Right? So it really changes the way a patient perceives the treatment plan, and it changes the way that you're able to deliver this entire plan as well, so that you feel more confident in making sure that the patient has, the full idea of what is going to happen as far as the results, and also what's going to be involved as far as tools, and you're giving the pricing.
Also, Vanessa, in the consultation, Vanessa clearly outlined the effect that the patient is going to see. You're going to see lifting of the shadows, lessening of, the hollowing in this area, strengthening of the skin. So I feel like once you write out, what did you say, eye frame rejuvenation? The patient is like, oh, okay, she talked about what that means for me. Or around the mouth, mid-face rejuvenation. Oh, she talked about lifting of the shadows. So truthfully, most patients are less concerned about the amount that you're doing and what effect they're going to then, and they're more concerned about what effect they're going to see. So two very strong points in a consultation are change your verbiage. I think that's the one thing when I'm training our staff. Sometimes the verbiage that they use is so technical. It's so technical. And I'm like, our line of work is so interesting because patients come in and they know that they're going to be injected with a needle, but they don't want to know that they're getting injected with a needle. So you have to finesse your wording in such a way where you have to use very strong adjectives and list the effect that they're going to see versus say, I'm going to go and inject right in here and I'm going to inject deep.
In order to remove these shadows, we're going to inject super periosteal in the piriform aperture zone with 0.2 cc's of this. Your patient doesn't need to know that. And
no one wants to know
exactly what the technique is, tell them.
Usually only our nurse patients ask.
Yes.
That's it. Yeah. Everyone else doesn't care.
Yeah, and that's fine. But for the most part, patients want to say what their concerns are, and they want to make sure that they hear it back from you, that you're going to mirror them, right? And address those specific concerns. They want to make sure that you get it,
you understand
that you're listening.
That's what I was going to say is the second most important point is whatever concerns a patient is saying, repeat it back to them because that's part of like what we learned in school, right? Active listening. So they want to know that you hear them, you understand them, and that you're going to take care of them. And then the rest of it from there is really delivering the results after that.
Yes.
Which is the fun part.
Yes. Mm-hmm. So that whole consultation process, okay, so we walk out of the room, we write everything down on the menu, I leave it with the patient. 9 times out of, well, for me, 10 times out of 10, But because my schedule is so booked out, so patients know if they're coming to see me, typically they want to get like everything
try
done
again next year.
Yeah, right. But usually 9 times out of 10 for everyone in our practice, what ends up happening is when we pop back in, we literally give the patient like a minute, like maybe a minute or two at most to look over everything. When they pop back in and the provider says, okay, did you look over the menu? Do you have any questions about anything? What would you like to move forward with? What happens?
All of it.
Yeah.
That's what they say.
Patients say, I want to do all of it.
Yeah.
But that was really different from when back in the day, I used to do my consultations one way and I kind of let everyone have creative freedom over, you know, how we were assessing and consulting with patients. And, you know, someone would deliver, so we're going to do 4 syringes in this area, and then we're going to need a PRFM and then possibly threads in this area, and then I'm going to use it in this technique, and here's the price per syringe.
Oh my gosh.
Patients would usually say, I don't really think I need all of that, or I don't need, that seems like a lot, or, you know, this is my budget for today, I can't do all of that. Because when you list and itemize everything out, it looks insane, right? Like,
it's like it can be a really long list if you think about it, and like the quantity next to it, like imagine like 2, 3.
It's
a lot.
It looks insane to someone who's not in the industry. However, being in the industry, you know that, you know, 5 cc's, a teaspoon of filler when you're trying to remold and replenish the volume loss of a full cheek zone in medial and lateral, and you want to make a nice step-off transition from, you know, the actual zygoma going into the submalar zone, like that requires more volume. You actually need more volume and the right techniques to make sure that someone looks more natural. One syringe placed incorrectly and doesn't taper off into other zones can look insane.
It's more noticeable.
It is, because it just stands out. You need typically more supportive filler. So we talk about things in teaspoons, half a teaspoon, teaspoon. For my more mature demographic who has more volume depletion, we'll go into 2 teaspoons. We also like to talk about duration. If patients have a little pushback, or not pushback, if patients have concerns of like, okay, so I'm paying a few grand for today, how long does this last? You know, like, is this something I have to do every 3 to 4 months? No. Once we do this full facial balancing for you, most of this result will last you the better part of 2 years. Depending on your metabolism, you are going to see me every 3 to 4 months. So once a season is how I like to position that. You'll see me once a season for your Botox treatments, for your neuromodulator. You'll see me once a year, most likely, for your PRFM treatments. But what we're doing today, as far as like full rejuvenation, that will last you the better part of 2 years, sometimes longer.
And they like that, because if you look at that from the amount that they pay
from the girl math,
it's the girl position. Math. It's mathing. It makes sense.
Yeah, if you're paying $3K, if you're paying $4K, and this is going to last you 2 years. $4K divided by 365 times 2. For $4 a day, you could look exactly the way you want to look. You know what I mean? Like, no one's saying that in our office, but I mean, like, if someone really was like interested in it, I love bringing up girl math. Actually, when I used to read, when Oprah magazine was like, that was like my jam in college. I remember how they had like a girl math section, which it wasn't called that, but it was like, do you have your eyes on this like luxury bag that costs like, you know, $8,000? If you use this bag every year for the next, every day for the next like 15 years, you're really only paying like $2.50, right? It's like, I don't know if that really adds up, but you know, it makes sense. It's mathing. It's all of that. The girl math is mathing. So when you break it down like that, it's, you know, very useful for patients.
Also, if you have like, it's rare, but there are patients that they're a little, overwhelmed, right? So what I like to do is I will typically ask my patients who I've done full facial balancing on, if you're not comfortable with me sharing your before and afters on social media, can I keep it in a separate folder and just show patients in office? And, you know, they'll look at it in office on the iPad, and most of them say yes. So when a patient's sitting in my chair and they can't make sense of what mid face is going to look like on them, I show them. Can I ask them? Can I show you a few examples? Someone who might have in a similar age group as you, or someone who has the same face shape as you, and they're like, oh yeah. So then I'll bring in my iPad and I show them like probably just 2 or 3, if that, and then they're able to visualize what I'm saying. So they're like, okay, this is what she's going to deliver. And then they feel a lot better about that. So that's also another important part of it. You don't always have to share your before and afters on social media. Sometimes you can just have it to show in office, and most patients are agreeable to that because they understand. They're in the position of, oh, I wish I'd seen more before and afters as well. So I do that for patients, and they really like having a visual as well.
So to close the conversation with the patient, you end up saying, okay, so this plan is addressing, and then one more time you say really quickly, we're going to bring things to light. We're going to minimize shadows. We're going to do some lifting and some redefining of certain zones. Are you ready to get started? We can go ahead and clean you up. And patients say yes. And then you get to it. So that whole process usually takes 15 minutes, maybe 20 minutes, and you have the rest of that 25, 30 minutes to do your procedure, which we all know once you're in the groove of things, like let's say you're not a first or second year injector, but when you have like 5 years under your belt, 10 years under your belt, you can do the entire treatment. You're not rushing the patients by any means, but these are small, procedures, and it's generally not something that takes an entire hour. If you do need more time, then that's fine, but you've just opened someone up who came just for lips, just for cheeks, just for chin, to an entire plan, and you're the only provider in the area who's doing that for them, and you're going to deliver on that plan, and now they look fabulous. And it's something that just took a few extra minutes, a few extra questions. So I really want you guys to start implementing this week. And please hit us up in our DMs.
Yes.
DM Janet, DM me. You can DM thethingswedo.co. We have someone who lets us know, if they have questions about the podcast, any of that stuff. And let me know what that initial conversation change, that initial consultation shift does for you, because we love hearing from you guys.